My name's Hugh Paterson. I'm a retired cardiothoracic surgeon with an interest in various research projects. I'm currently guiding the Mitral research project, which is a large animal study. As for the background, I became a cardiac surgeon first, but I recognised that as a clinician I had a responsibility to investigate and get involved in research. So shortly after I became a consultant, I attached myself to another research team doing large animal studies, and that was great exposure. That was about 30 years ago. 15 years ago I set up my own mitral research program on an absolute shoestring budget, and we managed to get some interesting results. Since then I've been helping other researchers and learned a lot from their techniques, and now we can really make an interesting mitral research program. I think we can make the results of open heart surgery for small groups of people better because there's an issue with treating the mitral valve where we lose left ventricular function. That's the main pumping chamber in the heart, and the patients don't do so well. In ischemic MR, if we replace the valve, most surgeons chop out the entire anterior leaflet. And that impairs left ventricular function. They don't need to do that. We've got to find a way of retaining it, either by better repair results or by using a prosthesis that allows retention of the anterior leaflet. When we operate on them and we chop out the anterior leaflet, probably about 15 to 20% of them die. And we can cut that down a long way. We can definitely get that down under 5%. We use an ovine model where we set it up with strings inside the heart. We don't paralyze the heart, no cardioplegia. We use normothermic beating heart throughout. We empty the heart, we're operating on while it's beating and empty. So we get very good myocardial protection. As soon as we come off bypass, we've got a normal heart again. Because we set it up with strings inside the heart to perform interventions on the mitral valve, on the beating heart off bypass, we measure instantaneous changes, so there's no time for physiological adaptation, and that gives us highly significant results with a very small number of animals. We use the conductance catheters and the pressure catheters. They're absolutely vital to our research. So we've got the MPVS hardware system, the Power Lab chart, is great technology. This sort of research was carried out initially in the mid-80s. And in those days they had a state-of-the-art computer with a massive 64 megabyte hard drive. And they had reams of paper printouts strewn all over the floor. The computer ran MS-DOS. We've come a long way since then. But those guys back then, they did amazing work. And I just think, how lucky am I? The support from ADInstruments right from the outset was comprehensive, to say the least. They trained our entire team. They gave us a complete rundown of all the equipment that we would require and educated us in the use of that equipment. And so we were up and running very quickly, surprisingly so. I do have a little bit of pride in that we've been able to set up a unique model which has been productive. What am I looking most forward to? I'd like to think that we can change thinking amongst clinicians. I might be dead before that happens. But if we can get the information that one day will change thinking, we'll be ecstatic.